with physicians, it changed so much, right? Offices were closed for months and months, and now we're really still beset upon with patients who have delayed care that's so necessary, and it's getting worse and worse. And so you have just logjam of being able to get patients treated, processed through. Costs are getting even worse because those conditions have gotten worse, and they've been uncared for so long. We were really moving a system of wellness care. We're trying to be proactive about things, and COVID just threw all of that out the window. Some people are still afraid to go into offices and go into hospitals, and having to make sure that they know that it's safe, it's a safe environment, that they're not going to contract COVID in those cases, and they're doing more harm to themselves by not getting the care that they need. The cost of healthcare, and it was beforehand, and it still is today, it's untenable, and we realize that. And you look at how healthcare is taking up more and more of gross domestic product, of the state budget, of personal budgets and business budgets, and that's unsustainable. And we need to be part of the solution of that. Otherwise, governments, be it at the local and certainly at the state and federal level, are just going to put broad-based solutions on that I think time and again have shown they haven't worked really well. We've seen a lot of consolidation in the market, and that has been shown again and again to not actually lower costs. It increases costs a lot of the time, and it makes things worse. So keeping practices viable, keeping different modes of practice viable. So if a physician wants to be in a large integrated group, fine. But if they want to be in a small practice, that should also be an option in a way that is sustainable. And right now, you're not seeing that. You're seeing people retiring from that side and nobody filling in and taking that. And I think that's a real problem with our system. But the overall cost of healthcare is one that we have to address and look at the bigger parts of it and those cost drivers and find ways to offset it.